A very good evening to everyone. Uh, and Thank you for making time off your busy schedule to make it to Digital Samwad. My name is Prithvi Deshmukh. I'm a marketing manager at Docon, and I'll be your host for this event. And The basic idea, the inception behind Digital Samwad was to provide a digital platform wherein we look at exploring healthcare with a new perspective, also provide networking opportunities and brand building opportunities. Along with, of course, this included sharing your experiences. Folks, now I'm going to introduce you to Himanshu Jaiswal. He's our director of sales. And Himanshu, we look forward to hear your thoughts on Docon. And welcome
Hey,
again.
thanks, Prithvi. Welcome, Dr. Sanjay, and welcome all the doctors who have joined this webinar. Thank you so much for taking your time joining this. My name is Himanshu. I lead Docon Sales Pan India, and I have been lucky few who are part of Docon since almost day one. And I just wanted to take a couple of minutes to give you a brief understanding of how Docon has evolved in past 4 or 5 years. Docon was basically started somewhere around 2015 back in Gurgaon by three of our co-founders, Alokik, Nishant, and Tarun. And what started mostly as a uh, experiment, of course, Alokik's mom was a practicing pediatrician where they identified the problem that doctors were facing, and with her help and a couple of other doctor colleagues' help, they were able to come up with a very basic version of Docon, which after a few months caught eyes of a lot of renowned doctors who were very happy to see that there's a product like this which can help them manage their practice so nicely, easily, and the prescription looks so beautiful that they started getting a lot of queries about how can they actually come on board, and that's where it clicked to them that they can actually take Docon as a proper company. And back somewhere in 2016, we got registered as our headquarters in Mumbai as a company. That's where I joined, couple of other folks joined. uh, when we started, I think, of course, the aim has always been to provide a solution to doctors which can help them manage their practice as easily as possible without changing too many things that they're already doing. We understood that doctors have a way of practice, and every doctor almost have a unique way of practice. And I think that was the biggest challenge that any other EMRs were also facing, which Docon always kept a very specific focus on how can we actually provide a customizable solution to all the doctors which fit as per their practice and as per their requirement. And I think that has been the major reason why Docon was so easily acceptable throughout all the doctors. Of course, we started our initial first 1.5 years were primarily a pediatrician based product, and slowly we were able to add a lot of other specialties. A lot of uh, KOLs and other renowned doctors joined us, and they have actually been very instrumental in taking this company forward, where they have given all the support, all the guidance needed to actually master every specialty and understand the needs properly. And with their inputs, we were able to come up with a beautiful product for almost all the specialties that we serve today, and continuing our vision of providing a very quick and easy to use solution. I think during this journey, and of course, all over world, we faced a roadblock, which was the pandemic. And during the entire nation lockdown, a lot of doctors have started reaching out to us asking how can actually Docon help. And that's where it clicked us that, okay, why not come up with a solution that can help doctors connect with their patient remotely. Of course, things are being managed via Zoom call or a WhatsApp call, but uh, seeing patient on a Docon app and helping them share the records and everything was a different experience altogether. So we very quickly adapted to the change. We were able to roll out a working video consultation module in less than a month's time, which actually was again widely accepted by all our doctors, and they were very happy to see the uh, quickness and the ease with which we were able to adapt to that. So I think last 5 years have actually been nothing sort of an adventure for us. We have grown from a couple of doctors to almost more than 5,000 doctors who are using the product across all the specialties of Docon, and all of that has been possible with the support of doctors and the love that we get from doctors. So yeah, that's it from my end. Prithvi, you can take it forward.
Thank you, Himanshu. I hope we continue to be on the growing curve.
Yes.
Thank you for your words again. So, folks, our topic for the current webinar is current disruption in Indian healthcare, which I'm sure Dr. Sanjay Wazir will be explaining in detail. So, just to set the agenda here, we'll be talking about the disruptions, how actually we can use them and apply them in the potential usages, along with how the benefits of social media, and learning a little bit about the new models. As a host, of course, it brings me immense pleasure for I to introduce our guest speaker for the evening, a renowned neonatologist, a practicing pediatrician with experience of 20 plus years, an author, a researcher, a teacher, and especially as I got to know him, a YouTuber as well. So once again, with immense pride and happiness, I'd like to introduce Dr. Sanjay Wazir. Doctor, hello and welcome. I'm sure, Doctor, I could not do justice to all the list of accomplishments you have. So I'd request you to please start by introducing yourselves and then take the webinar from there on. Thank you again.
Thank you. Thank you, Prithvi. Can introduction. And I thank Team Docon for giving me this opportunity to be talking about a subject which is very passionate and very close to my heart. And with this webinar, I wish that some of my colleagues, some of them are actually very pro digital, platform, but some of the doctors are little resistant to change. And I hope at the end of the webinar, I'll be able to convince that this is what they need to do. About myself, I am a neonatologist. I did my MD from PGI Chandigarh and then did my DM in neonatology. And for those who have been in NICU, we deal more with machines, ventilators, ICU monitors, the data coming from ABG machines, and it's also about the patient. But there is a lot of data from these ancillary things which made me go towards digitalization and to adopt that kind of into my practice. So I have done almost 35 papers into the various journals and the medical books. I have authored a couple of medical books, and two of them are upcoming on HIE and jaundice, and that's my medical part of it. I've been doing my practice for the last 20 years, but I also have varied interest in other aspects apart from digitalization. I also writing a book. So this year probably I'm going to launch a book, publish a book which is called Bundle of Joy for Parents. And as it was mentioning, I also run a YouTube channel, Kids Health by Dr. Sanjay Wazir, which is to connect to people who because connecting to people, all the people face to face may not be possible all the time. And I am also a teacher for running a fellowship program in neonatology post MD. This is about me, but why we need to understand before we go into understanding the innovations and disruption, we need to understand why, as doctors, do we need to know about these innovations and disruptions. We'll take them as the time comes. Now, one thing we must realize, there is nothing permanent except a change. The only thing permanent is a change, and it's important that people should be on the right side of the change rather than waiting for change to happen and then try to jump on the bandwagon. The biggest innovator of our time, Steve Jobs, he made a statement that the biggest innovation of the 25th century will be the intersection of biology and technology. Although we always credit him with iPads and iPhones, but he also he had a vision to understand that when wealth becomes more or less equal in different parts of the world, then the next thing people would seek is health and demand so much from technology and medical science that to improve their healthcare. So he had the vision to understand that somewhere the medicine and biology and the technology have to marry for humans to have a better life outcome. In the last 10 years, we have the answer is to the why is that in the last 10 years, we have not realized, but there have been disruptions in almost every field, whether you have talked about transportation from metros, now we have Uber, disruption in transportation, retail things you need. Most of us now order on Amazon the things that we need. We moved away from the theaters into the comforts of our homes and watch Netflix at home. Airbnb has been a disruption in hotel industry, and there are multiple other kind of fields where disruptions have happened, and it is not difficult to understand that medicine would not be left behind as far as the disruption is considered, and it is happening faster than what we think. So when some of the doctors say, okay, why bother about it? We'll learn when it comes. The only example I cite to them is companies like Nokia, like Yahoo, like Kodak, films that you put in your cameras way back. They have almost virtually disappeared at trying to find a survivor, because what they did not do anything wrong. They were perfectly fine. Somehow they lost because when the game changing was happening in the touch phone industry, the or the smartphones, at that time Nokia stuck to its own model. So it's important that we should not replicate their mistake. Now, when it comes to healthcare growth trends, the healthcare sector almost has increased to 8.6 trillion in 2022, and financial year 22, the healthcare infrastructure is expected to reach almost $350 billion, out of which 11 billion is only the e-health market size. So having understood at least the need for it, we'll talk about what are the disruptions and innovations that we see, or maybe we have heard about, but we must go into details. In one seminar or webinar, we may not be able to cover everything, but it is important that I'll just brief you about the various innovations that are happening. And once you have time, you probably can go on YouTube to understand and maybe read further, or maybe happy to interact with you one-on-one whenever you have time. I'm also going to talk about what has changed in the healthcare delivery from a volume-based service to a value-based service, and benefits of using social media for practice. Before that, we need to understand what is the need for innovation in the health sector. Now, the reason is you have a very unstable operational landscape. You probably had COVID last year, and many of the hospitals were not having enough patients because acute illnesses. And as pediatrician, I know for myself, my practice dwindled by almost 70%, like during the peak, just before the peak COVID time. Then suddenly there was a huge rush at the time of COVID, that you ran out of the beds in most of the hospitals. So very unstable operational landscape is there. Then there are technological changes which are happening from, like, when we started our practice, we hardly had an MRI in one part of Delhi, and then over the years we see probably MRI being ordered left, right, and center, from 1.5 Tesla to 3 Tesla to brain suites. Things have changed dramatically. But what is more important for innovation, the need for innovation, is the insurance companies, or even the Ayushman Bharat, or other intermediaries. There are large budgetary cuts. The healthcare is one of the most 20 million people get below poverty line in India because of healthcare budgets only. So that is the reason why people are looking for innovations, if they can, to reduce the healthcare spending, both by the government and also by the public. And also patient needs are changing. So we think we are busy practitioner, but the patient sometimes is equally busy, or at times more busy than the doctor. and he hardly has the time. So he would probably want a digital consult. He may just want, somebody to come over and, do the test in the morning. There are other patient needs which we need to cater to, because those are the population that we're looking at. And we're no longer in a position that we say, okay, we have to say customer is the king or the patient is the king, which is, happening sooner than what we are realizing. And 60% of problems nowadays in the global scenario are related to long-term health problems, chronic health problems. So they would also need to be looked at, how to prevent them and how to manage them without without increasing the interaction between the doctor or with healthcare and the patient. So this is bound to happen whether we like it or not like it, and that is something which is happening with the aim that we need to achieve better healthcare outcomes. We need to achieve those better healthcare outcomes at lower cost of care, with improved patient experience and improved staff experience. Now, having
Yeah.
understood why it is happening and what is happening in the society, what are the disruptions or innovations that we are talking about in this platform? So that we already talked about like teleconsultations and video consultations, which is like very minuscule part of the innovation that we're talking. And in fact, we're not going to talk about teleconsultations because that's more or less now universal, and many people have adopted to that kind of a model. In fact, in US, Kaiser Permanente, that's the largest US network OPD chain, they have more video consultations than they have physical consultations in their on their platform. So in 2014, the ratio was only 20/80, and now it is like 60 and 40. So it's happened in US, it's happening in in our country, and it's important that we pay due it in kind of importance to the teleconsultation model for our practice also. And the things we are going to talk about are blockchain, Internet of Things, artificial intelligence, robotics. There are virtual reality and 3D printing, but we're probably not going there because we'll cover them in some other seminar as well. The most interesting of them is the blockchain. When the blockchain word comes up, everybody associates this with a digital currency, the Bitcoin, the Ethereum. And the moment we talk about cryptocurrency, people have varied opinions, and most of us feel that this is some kind of a spam. It's not real, and there are some hackers behind this particular concept. Uh, people are going to lose money because they think that this is a false world which is happening there. But blockchain does not alone apply to only the digital currency. It would come up in different ways for different parts, different fields, from your intellectual property right to finding out about the authenticity of the artwork that some painter has done so that duplication can be avoided. Your own house, who owned it in 2000, say, and now in 2010, who is owning, then he is sold to whom, at what price, all that will be part of like blockchain. And healthcare is no different than healthcare. We will probably have been seeing the adoption of blockchain faster than in other fields as well. For those who do not understand blockchains, blockchain is, and to talk in terms of money, suppose Sanjay Wazir, has to transfer money to Prithvi. Like, so normally what we will do is like we'll send money to the bank or to the wallet, and the wallet sends it to Prithvi. Now, yeah, there is a chance that there may be an error happening and the transaction might fail, or sometimes my money gets debited and it does not get reflected in Prithvi's account, or there are other sources of error which can happen, or a fraudster actually hacks into my account and transfers money. Instead of giving me transferring to Prithvi, it goes to some other account. Now that central repository is gone. As far as the blockchain is concerned, there's no central repository or a registry or a central agency. All is that if I need to send money, me, Prithvi, and Akash have gone for dinner, for example, somewhere, and if I go to a dinner and we decide to split like in each 100 rupees each, and I pay 300 rupees. Now both of them need to pay me 100 rupees. So he will create a block by an algorithm, and it goes through the node. And Prithvi and Akash and me all would know that 100 rupees are coming through that node. And unless all three of them approve, the transaction does not go through. So what it means that if there are 4 or 5 people involved, all of them have to say yes, otherwise the transaction does not go through. And this makes the system foolproof because it is not one hacker involved. You have to have a consent of all the participating people, and then there is no central registry. And the data privacy is also there because the person who's receiving the money only receives if he has a key or a hashtag key to the transaction. So the advantages of blockchain is that since there is no central agency, there is no middlemen or fees involved. The staffing is not required because people who are doing, we are doing a transaction among ourselves. There are reduced errors and it is virtually tamper-proof or it cannot be tampered with easily. Now, challenges in the Indian healthcare industry have been healthcare interoperability, or if patient goes to a hospital A, and then next time he gets admitted to the hospital B, the hospital B does not have a data from hospital A. And he may have suffered stroke in the hospital A that the hospital B does not know about it, and he may be treating on a different line altogether. And so the other thing is that we may fill up a data, and eventually it's the transcriptionist who fills up the data at the end of the day to generate a discharge summary, and he may have filled it incorrectly, where it will hamper the long-term health of that particular patient. And one of the major problems in India is the counterfeit drugs, like the drugs which are duplicate in nature. And I'll just in a minute tell you how that thing can be helped with blockchain technology. Right now, the blockchain opportunities in healthcare are electronic health records, remote patient monitoring, drug supply chain tracking, and patient data management. Now, I was talking about if you look at this slide on the left side, this is the conventional model. Like there is a manufacturer who makes the medicine on the complete left side, and then there's a patient or the consumer on the right side in the upper diagram who has to receive the medicine. Now the manufacturer sends this to the distributor and also transports directly to the pharmacy. The pharmacy may also send it to the hospital or may send it directly to the patient. And if there is a counterfeit product anywhere in the system, it will be difficult to locate where did it come from and who is the culprit, and how to ensure that the original which the manufacturer made in the first place, that kind of a drug reached the patient. Now, look at the same example using a blockchain technology. The moment the manufacturer makes the medicine, he creates a block which authenticates and gets into the next transporter. The moment it reaches the transporter, another block is created. Then it reaches a pharmacy, another block, different block is connected. And all these blocks are connected through a chain, a virtual chain, but they're connected. And if, say, for example, there was a pharmacy guy who was trying to push counterfeit product into this system, the blockchain would alert all the other people in the chain, and unless they approve, the fake medicine cannot be pushed into the system. So that is how, like, the counterfeit product, the currency, the hospital records, and all those patient data can be authenticated And this is the way, this is being used in art also. The next thing which we need to learn about is artificial intelligence and machine learning. And most of us have learned about, heard this term very frequently in the last couple of years. One of the simplest, the types of artificial intelligence is the weak AI, maybe, something like an Alexa, for example. Like, you talk to the Alexa, play a song, play, what's the weather like? So that is designed for one specific task, a very weak AI. There is a general AI, which is something which performs an action like a human being. Something like a self-driving cars, like, you just sit down and just put the direction and it takes you like a human would, or a driver would do. But most of these are without an emotional connect. And what people or scientists are trying to work on what is called a super AI, or which has an emotive component to it. Like, so not only would be able to diagnose, or at least read an X-ray, but also able to empathize with the patient that you have had a fracture or a hip fracture, and then, like, because of the emotive content. That's probably where we are heading for, but maybe not completely reached there right now. Now, the use cases of AI and machine learning in healthcare, I mean, I'll just cite a few of them. There was one study which looked at assessment of remote heart rhythm sampling and trying to figure out the diagnosis of atrial fibrillation. And what they found out, using this AI and machine learning, the detection rate of atrial fibrillation was higher. And the same thing they diagnosed in an artificial intelligence using interpretation of pulmonary function test compared to pulmonologists. And they said both the nurses and the AI software, the diagnosis by the pulmonologist was poorer compared to the AI software. There are wearables, and now they're trying to look at motion when this is for a remote detection of epilepsy, for example. You wear a band, and depending upon the type of seizures that you're having, they will be able to identify that the person is having a seizure, and the emergency help can arrive because it's connected through this mobile app into the hospital registry. So these are some of the examples that you would I've just cited, but host of other are available for in each field for people to know about using AI and machine learning. In fact, Save a Mob, there is one AI-based platform that is trying to reduce the cost of primary healthcare by up to 50% using only the artificial intelligence in that sense. Other potential uses on which you may have seen right now is the teleconsultations that we were just talking about, and grouping of them so that you can take an opinion from a neurologist, and a physician sitting in a remote area can execute that order. You could probably have like teleradiology, for example, is another potential uses of artificial intelligence. People have seen the detection rate of fractures on X-ray was better with the machine compared to the doctors. And even if that is not in use right now, but many centers are using central command system to collect the data and send it across to the doctor for confirmation. But at the same time, there is a neurologist, somebody who specializes in head MRI, for example. He's sitting in Mumbai. So people from Nagpur can send an MRI through and the MRI scan based on the artificial intelligence detect that there is definitely abnormality. Then it sends to the doctor for confirmation. This way, 50% of scans, the doctor's time is not wasted, and the patient also sitting in Nagpur would get an advantage of having an MRI report read by a specialist in Mumbai. Now, you would probably have seen healthcare chatbots, like, many times you go to an insurance website and you put, like, they say, what is your weight? What do you want to talk about? What's your date of birth? And all banks work on these chatbots till, they reach a level where they need a human interaction. And this is something which people are working to chatbots to help you lose weight, for example, motivate you to run and complete your work steps, and all those things are very imminent to come in next couple of years as well. Internet of Things for healthcare. Now, this is a concept which I'll just briefly explain that. Sorry, uh, sorry. This was like, so. Internet of Health is like you have a person who is sitting a remote in some part of say home, for example, and from there he has some problem. From here, he either because of a wearable or because of the monitor that is attached, or some other internet connectivity that he has, the data from that patient is transferred to the cloud server, and this reduces the time between the patient having to seek a consultation from the hospital or the doctor, and the doctors can assess the patient data from the IoT and proactively make treatment decisions. And the moment that is done, and if the person is found to have some kind of a problem, the advice would come up, maybe the help would also come up. And this is something which is happening right now also in some of the hospitals in US. Robotics in healthcare. So we have already known about the hospital robots like Da Vinci's robot, which used for assisted surgery. And when it was like just heard about when we were studying surgery during our MBBS days. But now you see in Gurgaon itself, it has 3 places with robotic surgery being done there. So I'm sure, and more number of people are opting for a robotic surgery. Not only the robots can be used for surgery, but it could also act as a physician's assistant, taking temperature, taking a blood pressure, and recording the vitals, reducing the workload of the nurses. It can, like on the prescription, on the photograph below, you see the doctor fills in a prescription, and there is no one at the pharmacy, but the robot, actually because of the things which have been fed, the drugs which have been fed, can work and get and dispense it to the patient without a human interaction. And robots are also being used, especially China used a lot of them for during COVID times, when if there were hardly any nurses or the doctors available to work in COVID wards. The robots were doing the cleaning of the hospitals. They were using trays to carry medicines and files to the from one patient to the to the doctor. So there are multiple other things which are happening right now, and which are disruptive in nature. We also have heard about electronic ICU, and we at Cloud9 are doing it. This is an adult ICU, but we're doing it for a neonatal ICU as well. So where the person is sitting, observing the data from patients coming from remote places, as far as 200, 300 kilometers away, and the data has been projected on the screens. Is much like a stock market uh, kind of a picture. But after that, like when the the you know decision has been taken, then the relevant doctors or the nurse practitioners in that particular area, they kind of get interact on board with the patient being on the same frame, the attendant being on the same frame, the doctor in the remote area and the current area, and then take a collective decision in and decide about the best course of action, which is in the interest of child. The other disruption is now, like, as you said, we are busy as doctors, but so are people. Hardly anyone has time in a busy world, especially those living in metros, are finding it difficult to, find time for physical consults. And healthcare at home has to be provided, and it's like one of the fastest growing businesses in healthcare. We all know diagnostic tests, ECG, all those can be done. You order them at night, and in the morning the guy comes with takes out your blood and then takes and gives you a sample report in the evening. But the model has to change slightly more. People have also looked at trying to start, even offering home ICU beds, geriatric care at home, uh, like post surgery recovery care at home. So this is happening in Cloud9. We did because during pandemic we hardly had people wanting to come to the hospital, so as to ensure the safety of the children and making sure that they would get their vaccine on time. So the ambulance were used to be sent to the patient's home, where they would come down and get the child inoculated and go back to their home. Then ambulance would come back to the hospital. So instead of patient coming to the hospital for healthcare, the healthcare was being delivered, and we are trying this model also in fetal heart monitoring at home, because many of the mothers, maybe because of sickness or because of other reasons, are not able to actually come to the hospital for routine care all the time. In fact, although PCP and DT Act does not allow, but if you see the picture on the right, the simple iPhone that you carry, nowadays ultrasonic transducers are available where you do not need a big machine. You just need to plug in a monitor, and even not even a plug in a probe. Sorry, you would have wireless probes also available, where the picture can be seen on an iPhone while you're doing an ultrasound, and that can be done at home by a technician to be read by a doctor or AI somewhere else. So, biggest thing when I've scared you about all those innovations which are happening and they look quite scary from our job perspective, uh, where do we stand in future as doctors? You would have heard the news that a Chinese robot became a certified doctor, and he scored 96 points higher than the best human in that Chinese university. So a graduate, like, he could answer all all the medical questions. So we, whether robots are going to be the next doctors, for sure, and there is a distinct possibility happening. But what we for sure know as of now, the AI will not replace physicians for now. There is an emotive component as a doctor. There is a intuitive component to a doctor, which is always going to be there. But physicians who would use AI would replace those who do not use. So it's important that we need to adopt technology before we are left out, as Nokia and Kodak was done. You want to take up the second poll? Okay. So, have you ever heard of benefits under the Health IID for Ayushman Bharat Digital Mission initiated by Government of India? If the choices are not aware, partially aware, fully aware, and not of interest. I mean, I'll leave it to the audience to answer that question. If you have heard about Ayushman Bharat Digital Mission. So we have the poll results. Like, only 12% have said that they're fully aware of what is happening. That's still incredible, considering that fact. Like a couple of months back, I was not even aware of it. 34% have not heard this term ever, and 51% say that they're partially aware of it. Okay, that's interesting stats. Now, the Ayushman Bharat Digital Mission was launched as a pilot project by the Government of India on August 15th, 2020, from the Red Fort premises by Honorable Prime Minister Mr. Narendra Modi. And the idea is that every individual in this country, like, has an Aadhaar card, would have a health record which is personalized and which is available to that person, and he has an ability and authority to share it with any person whom he or she wants. So there is an Aadhaar number which you need to generate, and you can, wherever you get the consultation, that needs to be uploaded into that particular system, so that the patient's health record is in this QR code. So the moment the QR code is read, and if the patient gives you a QR code or the number, and you feed it, and you can retrieve all that has happened to the patient, and with almost 5.7 lakh villages out of 5.97 villages in India, which leaves only maybe less than 2 or 3% fully, operational as far as the internet is concerned. India has the largest number of internet users in the world, and the data consumption in India is almost 8 gigabyte individually. One person would consume every month. So that's something which is incredible. So with that kind of interconnectivity, the digital mission, and one of the examples that you could possibly look at, COVID app, for example, Arogya Setu app, for example. These are the digital mission. 43 crore Indians registered on the COVID app, and India was the first country to even in US they used to give you a certificate on a piece of paper. India was the first country to give certificate online, digitally, electronically, and give because of adoption of technology by the National Health Mission, Digital Health Mission. Now, how this ecosystem works, that all people who are involved in the care of the healthcare of the individual, of the citizen of the country, whether it's the hospitals, whether the clinics, or even the insurance companies, or the doctors from the modern medicine or the Ayush ones, including the NGOs, including the administrators who are making the policy, including the central government and the state government, all are part of this ecosystem. So, I mean, right now, you'll be surprised how many people have this ABHA number. 17 crores. And I'm sure none of us has an ABHA health record registered right now. 11,000 doctors are on this, and the number is increasing because eventually, as Ayushman Bharat gets more and more visibility, most of us would have to be on that kind of a platform for you to be, the numbers is almost 21. This is the latest one. 21 crore people are there, and there is an ABHA app also, which is there for the healthcare delivery for India. Now, the major blockers to adoption by doctors is one is adaptation to technology, because the technology keeps changing, and we say, okay, how long we need to be changing from one to other. Consumer behavior is another issue, lack of awareness, visibility, and the biggest is resistance to the change. Now, from another model, we also get back to from a volume-based service to a value-based service. Now, till now, if you see, the annual cost of global healthcare is $7.8 trillion. 10% of the world's gross domestic produce goes into healthcare only. And this is increasing by 6% every year. And there are so many people involved into this, with 60% of chronic illnesses, as I just mentioned at the beginning. This is a huge cost which is spiraling out of control, and obviously it cannot go on like this. So Harvard professor devised a solution. Instead of fee for service, like the patient coming and paying for a consultation, he pays for an outcome. So outcome is so you come to me and say, okay, I want to get my appendix removed. And if the person gets complicated, I get paid less. If the patient gets without a complication, then I get paid more. So that's a value-based survey. It's based on the quality of the work. So which entails that as doctors, we need to be aware of using the protocols, the standard treatment guidelines. We also be needing to do is to collaborate with other doctors and friends to get the best possible outcome for the patient, which is a win-win situation both for the doctor and for the society, because you get paid for doing a better quality work, and you don't have to depend on volumes. But at the same time, patient outcomes are better, and if the patient does not develop complications, for example, that person can be a better productive individual for the society and the world as a whole, and that is a value add to everyone. So that is the reason why this thing has changed from volume based. So it's no longer going to say, okay, I have 5 appendix, 2 complications. You would probably want, be phased out by, and because people would know who what is your outcome, you are going to be phased out. So it's important as doctors for us to adopt a technology and to use some clinical decision support system for making sure that we stick to protocols. The other model which has come up into the healthcare is a subscription-based model. Like, there is a Seva mob in India. There is like any kind of health providers where right now, for example, for insurance, I have to go to Max, Cooper, Apollo. For a hospital, I need to go to this. For a lab, I go to this. There is one central agency which provides an access to all those things, and you pay for being a subscriber to that service, and you pay a subscription fee, for example, an X amount every month, and you have an access to all the services in this. So what it does is that it reduces the dependence on middlemen. It improves the quality of care because there is one single responsible authority. So many of us know when the ambulances also come, there are Maruti vans coming in ill-equipped and calling them, fully equipped ventilators. Ambulances where the patient and the doctor even cannot fit leave aside in case a resuscitation is required. So these subscription-based models, both in the primary healthcare and the tertiary healthcare, are increasing globally. And from an old business model, we need to pay for one service. Say, for example, I take the service of X hospital. So that will also take care of my hospitalization, pre, post, stabilization, my OPD cover, my health record, my health insurance. Even if I need an ambulance, everything is provided for at that point of time. Now, coming to last to why social media, and most of us are kind of very aware of, averse to social media. We always think in terms of, social media is not for me. It is something which, like, so before that, sorry, I need to see, in what ways do you prefer to interact with patients, face to face or social media? I want to ask people, like, do they use social media for connecting to the patients? Or in any form for that matter, not even with patients. So this is a result, and I think yes, as expected, as you said, like 78% want to do only the face-to-face, and virtual connect or a social media connect is something which only 22% of the doctors would prefer, and for obvious reasons, because we think that they are going to be disruptions in our life, and as doctors, we're a little shy in telling the world about what we know, and we think that social media is a waste of time. For sure it is, if you stuck to Facebook watching your holiday pictures of your friends and your family, but you could use it for your own benefit, and you can use it for the patient benefit. The principles of social media which are helpful in healthcare is that you get to learn, you educate people, you promote practice, and you create your own personal brand. Like, and I'll just give you an example of all the 4 things that we just need to say. And medical education. So I would suggest, so if you see the lower graph, IBM predicts that information doubling time is 12 hours. So which means that every 12 hours, there is a host of another information coming, that you would be impossible for humans to keep track of it. And if you see, I'm going to read a book, I'm going to use a journal for reading, that's just not going to be enough. Now, for example, the slide which I've pasted from my Twitter account is, I read what is known as neo papers. So I need whatever people, somebody is making a smart choice by putting up the best research papers in that last 24 hours or 48 hours, and then puts them on the web so that I can go through the abstract, so that I do not have to waste time, and I keep myself appraised of whatever is happening in the field by just looking at a couple of Twitter handles, and I know what is new happening there. So for your self-education, that is something which is very good for you to be, whatever you're interested in. It could be medicine, it could be like asthma, whatever. You would know better than faster than the patient, because many times patients come to you and say, okay, doctor, I've read this thing, and you can't cut a sorry figure and say, I have not read about it. Then other things, that if you see this man on the using a VR and kind of handles, and he's trying to do a learn and the prosthetic knee surgery. Now, how many of medical students would get to do a surgery before coming to the before they join they do the MS? But a medical student can also, using a VR, learn technologically on a VR stimulation platform, learn about the education. Then it also greatly improves your brand value. Now, like traditional method is that patients say, okay, word of mouth. Like, yes, word of mouth always counts. When I see a patient, the patient tells another person that you go and see Dr. Sanjay Wazir. The first thing, most people, if I show you, and like, is the first thing they do is like they go on the internet and read about you. 80% of 41% of people in America said that they social media would determine the choice of a specific doctor, hospital, or medical facility. And you would know that the hospitals per se spend so much of time getting a positive reviews, but it's not about review, but your digital presence makes the patient comfortable that we're talking about a doctor who has a digital presence, so he must be good. Sorry. And sorry, the other thing, which, as I said, like I have a YouTube channel which is called Kids Health by Dr. Sanjay Wazir. That are used for education purposes. Like, for me, for example, if I have to teach someone how to use an inhaler in my practice, and I have a very busy practice, for example, on that particular day, all I do is like, use a tab, tell the patient, please read, listen to this, and you will probably get how to use the inhaler, for example. Or hear about colic till you come and, I'll see you again in 5 minutes again. So I would ask the social media to connect to people. Say, for example, recently we had last year when the pandemic was there, the people who were connected to me through the Facebook or Twitter, I sent an advisory that the new influenza strain is available. Like, and because the flu is a distinct possibility in near future, so those who are interested, please come and get the vaccination done. So they reached out to me faster than and asking, and got a couple of more friends to come and get the flu vaccine done as well. So these are some of the examples you can use as social media platform to get patient connect driven over a period of time. So to conclude, I would want to make only one conclusion: disruptions and innovations happen. Please spend at least one day in a month to understand where the healthcare is moving, because change is inevitable and growth is optional. But growth is definitely going to happen if you are on the right side of the change. If you're on the wrong side of the change, then you're going to fall out. Like, again, my classical example of Nokia and Yahoo and Kodak. Thank you so much.
Thank you, Doctor. I hope and pray that not just us, but everyone who attended the webinar also learned from you. So, folks, we are open for Q&A. I already have a few questions which are in the chat, so I'll be asking Doctor those. So, Doctor, this one is from Shinoy. This is, I think, when you're explaining about EBDM. So, what are your thoughts on linking your neighborhood specialties and clinics to specialist clinics for instant advice? So you have clinics around your neighborhood. If you're linking that with specialist centers, then that would help in instant advice. What are your views on that one?
Yes, I agree to what Shinoy has to, has a very good thought. And then, there are physicians who are, like, say, for example, family physicians, and they would be able to do most of the work which the doctor can be doing. But 20 to 30% of the times, he would need also an expert advice from a specialist, for example. Now, the specialist availability in every area is not there. Say, for example, as I said, for every 10,000 people, you need, for 2,000 people, you need one neurologist, but we have right now for 10,000 people, one neurologist in the country. Like, now they need to connect. So if there is a digital connect, which connects three nodes, like between, like, the patient sitting in the mohalla clinic, the family physician being in the mohalla clinic, and the super specialist sitting in a Goa vacation home, like, so this, like, still that thing can go on, that the doctor examines. Right now, this was done through a second opinion model, where people would present whatever they felt like. There was no facility for someone to do an examination. And right now, the Mola clinic has done all the examination, put out the results to the super specialist, got his input, and the treatment is done by the family physician. And in turn, both value. The patient all three benefit. The patient gets the value-added advice of an expert in this area. The family physician does not lose the patient, and the super specialist gets to spend his time in Goa, at the same time earn, while he spends time doing what he's good at only the neurology consult, for example. He doesn't have to see as COVID patient for that matter.
Got it. I think we have time for one last question. So this is from Ashwini, I believe Dr. Ashwini. So how will subscription model benefit small hospitals?
So anyway, the subscription model right now is only for the patients, but, like, eventually this healthcare is going to be a network, like a network of small. There is nothing like a small hospital or big hospital nowadays. Even in the Western world, there's a concept of regionalization of care. Regionalization of care means, like, if for example hospitals like Medanta start doing, or XYZ, I'm not naming, but anyway, ABC, any hospital like tertiary hospital, start doing the primary physician's work, both get wasted. But here now there is a hub and spoke model, where the tertiary hospital is connected to the smaller hospital, which is further connected to a mohalla clinic or to a family, practice. So anyone arising here goes here, and if it's not handled, goes to the third person. Then it goes back to this, and the subscription model would be done by one insurance who would have access to all three, like, so would, like, so if he decides that the patient goes here or here, and eventually in NHS system, for example, now what is happening is that earlier it was fee for model. The patient going, and whenever he used to visit an NHS physician, he would bill, the NHS physician would bill NHS system for the patient coming to this. The government has done it other way around now. Is like, for some of the counties, what they've done is, like, they've given a set of doctors in that area a healthcare budget. So they say, for example, given them 10 lakh rupees for 100 patients. Now say, okay, you have to manage the healthcare of these, like, 100 people in that community with that 10 lakh rupees. That's a hypothetical number, but I'm just quoting it there. Like, and if the patient comes, like, and most of your patients end up with chronic diseases, heart ailments, then you automatically you save very little out of that 10 lakh. You can save whole 10 lakh to yourself if none of your patients fall sick. So your emphasis has changed from treatment plan to prevention. So you're now, as a doctor, also involved in making sure that he walks 10,000 steps every day. It is no longer a device, it's a commitment, because you are not going to get paid for it. So that's how, like, every hospital, everybody in the system is going to work and benefit.
Got it. Got it. So thank you, doctor, from my behalf and from Team Docon for actually conducting this webinar and taking us towards this important topic. From personal note as well, I'd like to thank you for that. And one special now announcement to everyone. We have got feedback from your end that you wanted a community. You wanted your own community. So from Docon's behalf, we have already created a Facebook community which you'll be getting in the follow-up emails as well. So please ensure that you join that community and help us build that. And once again, thank you everyone for attending, and special thanks to Dr. Sanjay Wazir for actually agreeing to be the face of this webinar. And thank you for your valuable time. So thank you. Thank you everyone for attending. Thank you, Doctor.
Thank you.